Hi, now we will discuss about the nose job, as we call, or a rhinoplasty in aesthetic surgery. On the nose, we are having three different options, three different operations. We can do a full rhinoplasty to change the shape of the whole nose. We can do a tipplasty just to change the shape of the tip, or we can do a closed nose suspension, which would take probably like 15 minutes. Now, the main question is, how are we going to choose between these operations? Which operation is the best operation for you? If you want to decide which operation is the best option for you, you have to look at the shape of your nose. Now, the nose has two different anatomical parts. We have the bone part of the nose, and then we have the cartilaginous part of the nose. If you have a problem on the bridge of the nose, so like basically the bone issues are more like your problem, then what we need to do is like to open the skin, to take the nose hump out, to break the bones and close it. So we are talking about a full change of the bony part and the tip part of the nose, and that is going to be called a full rhinoplasty. If you do not have a major problem on the bone part and you are more like concerned about the tip where the cartilages are creating the shape of the tip, then you can do a much smaller version of a rhinoplasty. We call this a tipplasty or an open suspension. In these operations, what we do under sedation or local anesthesia, so no general anesthesia is needed, we open the nose, we change the shape of the cartilage of the tip and close it. This will literally take half an hour. You will stay maybe a few hours at the hospital. After 1 week of paper bands, you are off to go. Third option is for the patients who are having a nice bone and nice tip, but who have a kind of like a longer nose. If the nose is longer, then what you need to do is to shorten the nose, and that can be done percutaneous in like less than 15 minutes, entering from the lateral side of the nose, creating a loop, hanging the tip of the nose upwards and shortening the whole length of the nose in general in maybe 10 minutes. To summarize, in the nose we are having three different problems: the bone problem, the tip problem, the length of the nose, and we are having three different options. A full rhinoplasty to change the whole shape of the nose, which would be taking around an hour operation. A tipplasty, which wouldn't touch the shape of the bone. It would give you a very natural result. The whole operation would take just maybe half an hour to reshape the tip, to get rid of the bulbous tip. A week of paper bands, and if you have a long nose, then just a nose suspension which is going to shorten your nose, and you will be off in 15 minutes.